Microincisional ambulatory phlebectomy is part of our treatment regimen for lower extremity venous disease. So for most patients, they have smaller spider veins, or what we call telangiectasias, that we treat with injection sclerotherapy. For larger veins, we utilize a procedure called microincisional ambulatory phlebectomy. Dick has this varicose vein, and we have a concern about his vein here breaking open and bleeding, because it's very superficial and the skin is very thin over it. And that's a common problem with a vein like this, Dick, is that you'll get a little bit of trauma and then you'll get a lot of bleeding from it. So rather than waiting for that to happen, we're going to go ahead and take care of this vein and get rid of it for you. During a microincisional ambulatory phlebectomy, initially the vein to be treated is marked with a surgical pen. Then the overline and the surrounding skin is anesthetized with a dilute solution of anesthetic, very similar to what we use during tumescent technique liposculpture. After anesthesia, very small incisions are made over the vein, and these incisions are approximately 2 millimeters. They're very small, and they're spread out about every 6 inches. These incisions are so small that when they heal, there's essentially no scar. And they're so small that we don't need to utilize sutures to close them. They'll close on their own in a matter of days. Then a very small needle is introduced through the skin and used to grasp the vein, and the vein is extracted through that small opening. For the patients, this is an essentially painless procedure. The recovery is immediate. Patients get up off the table after the procedure and kind of go about their normal activities, and many patients go right back to work after the procedure. It's 100% successful in that the vein is removed during the procedure, and cosmetically it's the most elegant way that we can do this. Historically, dermatologists have taken complicated inpatient procedures and turned them into safe, easy, efficient, but very effective outpatient procedures performed under local anesthesia.